Right. Well, I'll actually just give a couple of reminders, introductions. Uh,
Perfect.
this is birth control part two. Part one we did right around Rosh Hashanah time, before everything that's happened in our lives in Israel. So we actually put this off in the interim. So now we're zooming. I'll remind everybody that's here that what we talk about, I call it concepts and ideas. We're talking about halachic concepts and halachic ideas. We're not paskening halacha in any type of way. And remind everybody, the way that I look at this is hopefully gives you ideas that you could discuss with your Rav. When you have shilas, you could bring up relevant points that don't have to be discovered, that you've thought about before getting on the phone with your Rav. We had part one quite a while ago. Of all of the discussions we've had, it had the longest introduction to the topic, birth control methods. The introduction lasted about 35 to 45 minutes, and we hardly actually got to our topic at hand. Tonight, we're intent on speaking about each individual birth control method. We discussed a little bit of what is pru-revu, a bracha or a commandment or both. We discussed the bracha part of it and the commandment part of it, the obligation to have a boy and a girl. What happens if you don't have a boy and a girl? Why is the obligation only on the husband and not on the wife? We spoke about that an obligation wouldn't be imposed on the wife, something that, labor, which is carrying a baby, which is a painful and a sakana, that they wouldn't be obligated. So it's the husband's quote unquote responsibility. But what happens for some reason if he can't fulfill that responsibility? Well, we talked about the obligation is osek, to be involved in fulfilling it. Doesn't actually have to fulfill it, but he worked at it and was involved in doing it in pru-revu. You never get penalized if you were engaged in trying to accomplish it. We discussed also what happens at the point where you have a boy and a girl. Let's say you have a boy at 21 years old and a girl at 24 years old. Are you done? Are you finished? Or is there an additional obligation? When does osek end? And we decided or talked very much how it's an individual thing with an individual patient, individual person has to take their situation into account, and some people will due to family situations stop a little bit earlier with their consultation with their Rav, and other people will continue on depending on that family situation. How far must a person go in order to accomplish to have children, to have a boy and a girl? We discussed, do they have to go to a reproductive endocrinologist and proceed to IVF into a quarter, and able to accomplish that. We talked about, no, they must do things that are derech hateva, the normal way of trying, the normal way of having a baby. And if that didn't work, but they were osek, then they fulfilled their obligation. We discussed for a minute, can someone, after having 6 or 7 of the same gender, 6 or 7 girls, go ahead and try to pick the gender of their baby? And Rabbi Siegelman told us that he's spoken to Rav David Cohen numerous times about it. He says that that's not a problem. The poskim don't ascribe to that idea. Okay, so now we're going to move on. That was our quick review of about 45 minutes worth of discussion. Now we're going to look at 15 different birth control methods. After having a discussion with your Rav, going over the situation, there is room within halacha to go on birth control for either short periods of time, longer periods of time, depending on what the situation is. Obviously, someone who's undergoing cancer care for 2 years and can't get pregnant, Rabbanim will talk to them about getting birth control until their doctor says, it's safe to proceed. And we've had that. We've had that with numerous breast cancer patients and thyroid cancer patients. We've dealt with. We've had other people ask about birth control after having a baby for short periods of time, for longer periods of time, after having a few kids in a row. All of that gets put together for that individual, and we come out with a reason and a halachic opinion that they can go on birth control. So I put these in some sort of order. I did discuss last time a conversation that I have with my patients after they have a baby. And my basic conversation is there are 4 things you could do. You could do nothing. You don't have to do anything. I would love it if you got pregnant 3 months from now, even though that might not be your idea. But that would be great. Breastfeeding alone does give some birth control, decreases chance of getting pregnant, but certainly I have patients every year who are pregnant while breastfeeding. In fact, that's what a lot of my patients do. They breastfeed out until they find out that they're pregnant. The next thing is I look at it as a shorter term. A 1-year plan is breastfeeding with spermicide. We'll talk about all these different methods. A longer term, 1 to 3 years, we talk about pill or something related to the birth control pill. And for longer term, we talk about the use of an IUD. So that's the basic structure, using time as a jumping off point to help them decide. With that said, the first one we're going to talk about is with the withdrawal method. I do have a number of patients. Remember, I take care of not from Jewish, non-Jewish, of all types of backgrounds who use withdrawal as a method. I always laugh with them a little bit. I say the gynecologist hates that, and the obstetrician really loves that because some of them end up coming back pregnant with it. But from a halachic point of view, what is right or what is wrong with withdrawal as a method?
So when we talk about withdrawal, we're talking about just abstaining during the...
No, we're talking about...
Coitus interruptus.
Coitus interruptus.
So...
they're having relations.
Yeah, so when we
right in the middle, they stop.
Coitus interruptus, so that's what in halacha is called, dosh mi bifnim v'zor mi bachutz, that the couple has regular relations and then pulls out, withdraws at the time that the man is going to ejaculate. So I believe we spoke about it last time, and it's a very important point to consider that not all when it comes to shechva zer levatal and wasting seed, it doesn't mean that every single seed has to have the potential to make a baby, right? Or has to be able to make a baby, because when your wife is pregnant, or when your wife is postmenopausal, and they have regular intercourse, that's not going to be that's not going to be a problem of shechva zer levatala. Even though that sperm is not going to fertilize any eggs, it's not going to make a baby. Nevertheless, it's still not shechva zer levatala. It's a fulfillment of the mitzvah of ona, and the reason is because it's ending up in the right place. When the sperm is ejaculated into a somakum, into the vagina, so that's where the zera has to end up. And in this method, the withdrawal method, where a person is dosh mi bifnim v'zor mi b'chutz, so they're pulling out and they're being motzi zera outside of the body. So that's definitely not a preferable method of birth control. In a case where certain really, really extenuating circumstances, so then maybe the post can discuss certain cases when that would be permissible. But as a standard approach, not to get pregnant, number one, it's not effective. But number two, but moreover, la halacha, it is certainly ill-advised. As the Erev Onan, the mice of Erev Onan in Parshas Vayeshev, it seems like that the Gemara says that their issue, Rashi brings over there, that their issue was that they were dashmi bifnim v'zorim b'chutz, with the intention not to have children, and we see in Chazal how shunned upon that behavior is. So I definitely think that is not a halachic option for the couple looking to pursue some type of mode of contraception.
And just in general, I don't get that question from a frum person. Could I use that?
The Tzitz Eliezer mentions it. The Tzitz Eliezer mentions, there is, the Tzitz Eliezer mentions in Chelak Tes of Tzitz Eliezer, he mentions different methods of sperm procurement for semen analysis. So he has a list of basically a list of the options in the preferred order, and that withdrawal method is an option for the couple that needs to produce a sperm sample for analysis, where they could start being intimate, and then the husband will just pull out. So for that instances, for that requirement for the semen analysis, perhaps it can be entertained as one of the possible methods of procurement. There's an interesting machlokas between Rav Shlomo Zalman and Rav Tzitz Eliezer whether it's an acceptable method. But when used for birth control, it's not an option for the frum Jew.
As long as you brought it up, I don't know anybody who's ever done that in a fertility patient. I've not heard anybody using that.
People do it. It's better than I feel like it's better than masturbation, because everything is done through regular intercourse, and at the last moment they withdraw and then produce in the cup.
In general, we've talked about it before, is that there's a special condom that they use.
Yeah.
Number 2, spermicide, and there are two basic spermicides that we discuss. One is the over-the-counter nonoxynol 9, comes in different forms, in a suppository, a foam, or a film. And now there's a prescription. There's this prescription spermicide called Phexi, which comes in an applicator. And this works by a different method. This method changes the pH. That's why it's called Phexi, pH. It changes the pH in the vagina, and that ends up killing the sperm. I call it my 1-year plan when a patient uses that, making sure that they understand that, again, we get patients every year who get pregnant using it. And I always ask them, well, what happens if you get pregnant in 6 months or 8 months instead of 12 months? And as long as they're okay with that and say, Hodu Lashem, if they find out they're pregnant before they intend to, then they could go ahead and use it. So as far as efficacy, they're supposed to be pretty similar, the two different types, the Phexi and the nonoxynol 9, and we don't see a very big difference in between them. Like I said, every year we do find a number of patients that we have who got pregnant using that method.
So in terms of the halachic perspective, there was a question. It's interesting, the earlier tshuvas that were written about spermicide. So anytime you are inserting anything into the vagina, so then the poskim reference a Gemara in Ksubis, Gemara in Yevamis rather. It's also a Gemara in Ksubis, but the main Gemara is in Yevamis, Handaf Yud Beis. So there the Mishnah says that Gimel Noshim Mishamshus B'moich, that there are 3 different women that can use a moich, that they can insert according to Rashi, they can insert some type of material into the vagina to prevent the sperm from entering into, through the cervix into the uterus. And those 3 women, only those 3 women, Ketana, someone who's already pregnant, it's very unlikely that they're going to get pregnant, but if they do, it'll be a big sakana. And other than that, it's a problem. So the poskim questions whether or not this spermicide would be similar to a moich, and it most probably is not. It is most probably not. It is not a barrier of any sort. As you mentioned, let's say the VCF, what it does is, the toxicity in the vaginal canal creates, or the pH level, it just renders the sperm, unfit to be successful to fertilizing the egg, but it doesn't create any barrier. So therefore, according to most Rishonim, there's no issue for that. So therefore, many poskim assume that spermicide of various kinds are a valid method of birth control. So once your Rav gives a heter for birth control, like Dr. Herman said in the beginning, that once we're talking about a case where once the Rav is given a heter for birth control, then there's 2 different considerations. One main consideration: what type of birth control. So as Dr. Herman mentioned, if you are the type of family that having another child within the next whatever it is earlier than you anticipated, if that's okay with you, so then the spermicide method would be okay. You can ask your Rav, you could double check with your Rav just to make sure that he permits it. But in my experience, almost every Rav, if not every Rav, is comfortable with the spermicide method because it really doesn't create any block. It just makes the vaginal canal a toxic environment and doesn't allow the sperm to penetrate.
So
Healthy sperm to penetrate.
How about things that do block?
So that would be similar to, like, let's say, a diaphragm.
That's exactly it. So
I would ask you, how many patients do you have? I don't know, about a year, but how consistent do you have diaphragm patients?
It's very out of style.
Yeah.
So it's usually somebody who has a whole bunch of kids already and is still familiar with it, or it's a younger patient whose mother told them to ask about it.
Yeah.
But in general, it is very rare. In fact, it's actually very difficult for us to get one. There is a brand that is now sold. You could look at it on the internet called the Kaya diaphragm, which is a fits all.
Really?
As opposed to what we used to do, fit the diaphragm.
That's right. You had to be fitted for it.
Right. There are different sizes. It's a ring with a cover on it, and that gets placed inside, along with spermicide at the same time. And generally, one of the reasons I think it went out of style is they don't see such a big difference between that and spermicide alone.
Right.
So they stopped using it. But I do have every year a very minority amount of patients who ask for it.
In my experience, the diaphragm was always most popular when you had women that had to go on birth control for a short amount of time. So I actually had two similar cases. Both of the cases, the woman had some type of medical scare. There was a lump on the breast. There was something else, something on the neck. And the doctor wanted to do certain scans, and they said, absolutely do not get pregnant. We're doing in the course over 3 weeks, we're going to be doing a lot of tests. Don't get pregnant now. But after the 3 weeks, assuming everything is fine, then you can resume, regular unprotected sex. So you're not going to go on birth control pills for the next 3 weeks. You're not going to have an IUD for the next 3 weeks. At the time, they felt that the diaphragm would be slightly more successful than regular spermicide. And the condom, let's say, was questionable. So they used a diaphragm. I will tell you that both of those cases, two totally different cases, but both of those women ended up getting pregnant on their diaphragms. Baruch Hashem, Baruch Hashem, Baruch Hashem. The scare, the frightening issue that they saw turned out to be not an issue. However, both of them did get pregnant. If you look in some of the poskim, there are some poskim that hold that it's a barrier method, that it's a barrier. It's eitzim vavanim. It's as if the man was motzi zera on eitzim vavanim, on not in the vagina, because the diaphragm basically creates a blockage and doesn't allow for the zera to enter. However, it's generally assumed that in cases of need, it is placed high enough that the couple could have regular intercourse, they could have regular tashmish, and therefore, according to Reb Chaim Ozer, and I believe Reb Moshe goes with this, that there would be a heter. So I personally am matir for in cases where it's an absolute necessity. However, I can't, whether or not you can judge based on my personal experience, but I have not had much success with the people that have consulted with me and that I've helped. I haven't had much success with them actually not preventing pregnancy. So and also it's complicated because you have to get fitted. Maybe I didn't know there was this one size fits all. So that takes time. And I've seen different articles that the efficacy is based on proper placement and lemaisa on a realistic case. It's usually not used properly, and that's why it leads to pregnancy. So whether or not there's a heter, yes, it is controversial. There are many poskim who say it's a problem because it's more of a barrier than the spermicide. So which means, if we're going on halachic levels over here, the spermicide would be better than the diaphragm. There are poskim that say that the diaphragm is usher because of the barrier. There are also rabbanim who matrid in cases of need But if you could use the spermicide, that's halachically preferable over the diaphragm.
Okay, so let's just turn to condoms next. It's also a blockage. It's just a blockage in a different place than a diaphragm. So what's the story with condoms?
The difference between the heterim of the diaphragm over a condom is that although the diaphragm is inside and it serves although it's a blockade, it is a barrier. Nevertheless, it is inside, and the penis does enter the woman's body unprotected. In other words, it's skin on skin. The ejaculation takes place in the area. It happens to be that there was something else that was blocking the sperm from going up, and maybe it pushed it out. However, the ejaculation was actually in the vagina, not in a condom. It's true that the aver was located in the vagina, albeit covered in a condom, but in the vagina. Nevertheless, as soon as he pulls out, everything will come out as well. As soon as he withdraws, as soon as he exits the woman's body, all of the zera is going to come out with him as well. So you find that there, for the most part, I'm sure everyone on the call is familiar with the with the severity in which we look towards the condom. It's typically not a mode of contraception for the Jewish family. That being said, again, under extenuating circumstances, there are, if there's a case of pikuach nefesh, Reb Chaim Ozer has a tshuva in cases of pikuach nefesh when there's no other option of preventing pregnancy other than a condom. So then, there's certain heterim. But as far as a mainstream normative method of contraception, the condom is also not acceptable. Because it's mamish being matil zera al eitzim v'avanim. As soon as he pulls out, the zera comes out as well.
So in all of the years, I can't remember like somebody really getting a heter to use it.
Listen, there are fascinating cases. There are cases where the woman is allergic to the husband's sperm.
Right.
There are cases when there can't be any hotzas there because of STDs. There are certain, interesting shilas that the poskim have discussed, but you're right. On a standard level, it's not one of the accepted forms of birth control.
And we talked about for a minute the female condom, which I think that had maybe one patient in all the years that has used it. Instead of on the husband, she inserts that and it's inside, and she removes it after they have relations. So that same category, doesn't really.
I think so, yeah.
Okay, so I wanted you to talk a little bit about the rhythm method. And I wanted to ask you specifically, is there an issue with Ona when you use the rhythm method? Because in reality, when you figure out when you're supposed to ovulate and you take 6 days on either side of it, right? It's going to be a few days before mikvah, so nothing's going to happen then. But a week, 6 days after you supposedly ovulated, that you're not having relations. In relation to Ana, what does that do? Is that an issue, or could a husband and wife just decide they'll go to the mikvah, not have a for the next 6 days or 8 days? It's
a good question. The emes is there is a tshuva in Rav Moshe. I think it's in Chelik Aleph. I think it's Kuf Beis. Rav Moshe has a tshuva, Chelik Aleph Kuf Beis, where he writes that even that method of abstaining when during the fertile window, Rav Moshe writes that's usher unless you have a heter. In other words, again, we're all talking. This whole shiur tonight, this whole presentation is talking to the patients, to the couple who have spoken to their Rav, and it's acceptable according to halacha to go on birth control. So Rav Moshe says, if you want to go ahead and use the rhythm method to identify when she's ovulating and when she's not ovulating, and plan your intimacy around that calendar, so that's fine. You don't have to do any of the other methods. You could do this one. However, for the person that doesn't have the heter to go on birth control, let's say they ask the Rav, and the Rav says, no, it's not appropriate. You don't have such a heter. And So they say, okay, so that means we shouldn't go on the pill. That means we shouldn't use the spermicide. But what am I doing by not being together? Okay, so I'll abstain. Rav Moshe writes, even in that case, if you abstain for the purpose of bittul pruruvu, to not get pregnant, so Rav Moshe writes that that's also inappropriate. That's also a problem, and you need a heter. So it's a very interesting chiddush. But that's what Rav Moshe writes in Chiluk Aleph Siman Kuf Beis. Now, I think that this is now in terms of people who want to get pregnant. I mean, you can speak for the from the medical perspective in terms of the efficacy of this rhythm method. But I think, like we've discussed earlier, a lot of these methods proved to be unsuccessful. There is definitely a window of error, a margin of error, where people get pregnant because they didn't realize that their body was this. Ovulation was a little bit later, a little bit earlier. But what we've found, at least with my work at PUA, a very, very good approach, and the recommended approach would be the rhythm method with, using ovulation sticks with spermicide. In other words, the way it would look like is that a woman would be constantly tracking her ovulation with the sticks. And when the sticks show that she's absolutely not ovulating, there's no fertile window at all, then to use the spermicide. The moment the sticks start to show some type of peak or some type of elevated LH, and that the fertile window is here, then to abstain completely. And then to resume only after the sticks have shown that we're completely in the clear post-ovulation, and then resuming with the spermicide. So the two of those together, the spermicide with the sticks, are pretty again, not 100%, but pretty good.
Yep.
What would you say? What would you say? Now, I mean, really, I'll tell you, this is the difficult question that I get is when the doctor says that you can't get pregnant for, let's say, a certain medical reason. So then we have to look at the efficacy of all of these different modes of contraception, because when the doctor said you have to use some type of contraception before you can't get pregnant. So what is an acceptable approach according to the doctor? So from your perspective, if a patient, let's say they were having a scan, there was a lump on the breast, don't get pregnant before we identify what that is. So if they say, but doc, can we use the rhythm method, the sticks and the spermicide? Was that a safe enough method for you, or would you not feel comfortable with that?
So just using rhythm alone, I say works very well until it doesn't work. Your period is exactly 28 days until it's not 28 days. And there's so many things that could throw it off. By the time you figure it out that your cycle is affected by something, well, it's too late and you're pregnant.
Mm-hmm.
I haven't had anybody who did what you said, but it's those, although tracking LH, with the urine isn't, again, 100%. You do get some type of idea, and I get it. I get that concept.
Yeah.
I use spermicide, and when you fertile window, well, don't have relations, and I think you're in very good shape that way.
Cool.
So certainly, there's a difference between undergoing scans and receiving chemotherapy. Every thing is different. I've had discussions with patients who have to get chemotherapy, that for 1.5 months, that they would even put in an IUD for 1.5 months under those circumstances, because they absolutely cannot be, and that's the best efficacious method that they could use.
Yeah. I actually just had a shiloh with this, and it happens unfortunately very often when males are undergoing chemo. So the toxicity of the chemo can express itself in the sperm,
or they just don't know, and it's possible.
Yeah.
So
the shiloh is, so I get a lot of shilohs. Is it permissible for that male cancer patient to use a condom to protect his wife, that she shouldn't be exposed to any of the chemo or the radiation, whatever is going through his body and is getting released? Right. So that shouldn't, go in, so that she shouldn't be exposed to that.
I hear. So that's discussion about rhythm. The next thing we're getting is the big one, is the birth control pill. Well, I guess it takes care of all of those other issues. We don't have an issue like we have with condoms. We don't have an issue like we have with diaphragm. It's a pill that's taken one a day, the same time every day. Relations are, happen in the regular, normal manner. And due to a number of mechanisms that the pill has, the patients don't get pregnant, they don't ovulate, and if they ovulate, the body's inhospitable to receiving that conception. The pills are usually given, in a monthly cycle, and it was very interesting why it was done that way, because when they first presented the pills 50 to 60 years ago, women actually wanted to have their periods every month in the United States. In other countries, they didn't care, but in the United States, they did. So they were packaged as 1 month pills. A number of years ago, 2 decades ago, 3 decades ago, with now focus groups, women didn't necessarily want to have their periods all the time, monthly. So they repackaged some of the pills and they gave them seasonally, 4 times a year, and they called it seasonal and seasonic, although it's the same exact pill, just repackaged. A lot of my patients have learned from that, and they will create their own cycles of 2 months or 3 months or even continuous in order to avoid periods. And we have a number of different ways that the patients, take them in order to skip periods. So first, I just want you to talk for a second about halachic permissibility of the pill. Is there any issue with it? Do any Rabbanim have an issue once we've determined that they could go on birth control?
Yeah, it's always interesting to try to find a source in the Gemara to whatever the mode of contraception is. There is a Gemara in Yevamis and Daf Samech Ches, I think that's Samech Hey, Samech Ches, I forget exactly. But there the Gemara talks about a case called a kos shel ikrin, where a woman would drink a certain potion and it would sterilize her. It would create a category of serous. So the Gemara actually talks about whether or not a woman's allowed to do this, because a woman is not allowed to castrate herself. A woman's not allowed to saris herself and sterilize herself. We'll talk about that later, maybe. But the Gemara talks about whether this is okay. And the Gemara seems to say that since she's going to be ingesting something which will in the future have potential effects, so then it's not such a problem if she eats something which will cause her not to be able to have children. That's what the Gemara says, and it's actually mentioned in Shulchan Aruch. There is a comment of the Chassam Sofer that says that the reason why it was okay was because this discussion took place before the Takanas Rabbeinu Gershon, where a man could marry multiple wives. So even if that wife took some type of birth control, which was even something which would be everlasting, nevertheless, he could marry another wife and have children with that. But the Chassam Sofer questions if she would nowadays post the Takana of Rabbeinu Gershon, where a man is not allowed to marry multiple wives. So maybe the kos shel ikrin would be a problem. Okay, that's a discussion. But anyway, the poskim Minchas Yitzchak and others look to this Gemara as Yivam Samachei Amid Beis. The Gemara, the Minchas Yitzchak points to this Gemara and says, you see the fact that the woman is taking something which is thereby causing a state of inability to conceive. The Gemara and Shulchan Aruch say that that's okay. So they say the pills are okay. Most of the poskim, if not everyone, permit the pills. What's interesting about the pills, though, is that Rav Moshe in early tshuvas, when the pills were first introduced, so Rav Moshe had certain nida concerns. Okay, Rav Moshe had a very interesting chiddush that if a woman is taking pills and the woman knows that because she's taking these pills, she's going to see blood. Okay. Rav Moshe says that's absolute nida, and we have in Hilchos Nida when we have certain leniencies, like if a woman sees blood on a panty liner, or if a woman sees blood on colored underwear. Rav Moshe says those leniencies would not exist and would not be relevant to the case of a woman on pills, because she knows that the blood is coming. So if you know that the blood is coming, then you can't be lenient, even if it's less than a penny, less than a gris. So Rav Moshe has this chumrah. Some talmidim of Rav Moshe still are machmir like this. Many of the poskim nowadays even if they once upon a time accepted Rav Moshe's chumras, now they understand how the body works and they see how much how much advancement there's been on the science end, and how I wouldn't say perfect, but it's significantly more regulated. So I don't think we're machmer like that, but that is a consideration. But insofar as the actual birth control is concerned, it's a great option because there's no barrier, totally unprotected intercourse between husband and wife. The only issues are that it could cause staining. A woman has to remember to take the pill at the same time, and if they don't, then it could cause staining. So then we get into other nida issues. But again, insofar as the birth control is concerned, it's a very good halachic option.
Is there any issue in skipping periods, an expected period that's supposed to come? Is there any issue in taking the pill continuously where you just never get a period?
That's a good question. I think it's primarily a hashkafic question, because Hashem created the world and mankind and the female with a period, meaning for the most part, until they're postmenopausal, the woman has a period. Biologically, let's say it's monthly. Okay, HaKadosh Baruch Hu created the nida framework for husband and wife. On a hashkafic level, the beauty of Taharas Mishpacha, the benefit and value of Taharas Mishpacha, and the more you push off your period and you remove that from your life, so one could discuss on a hashkafic level, what that does to the marriage, what that does to your bedroom, your intimate life, etc. From a halachic perspective, I don't think that there's an issue. Assuming that that's what the couple wants, and it won't impact Ona. Maybe it'll on the contrary, it'll create more opportunities to have relations. But a very interesting shaila, which I get a lot, is on the week of the placebo. So the week of the placebo, she stops taking her pill on Motzei Shabbos. So Saturday night she stops taking her pill. So now what's the halacha? She's expecting her period, but what is she allowed to do? So I typically tell people within the first 24 hours, maybe first 36 hours, the body doesn't even know, the body doesn't regulate. You are allowed to have tashmish definitely within the first 24 hours. Mm-hmm. Beyond that, when the period is really can come at any moment. So then the couple should not have intercourse. They should not have tashmish. They should not have relations, even though she hasn't bled yet. Similar to an Ona day, on the day on her calendar when she's expecting the period, they can touch, right? They can touch. They can maybe hug and kiss. It's a machlokas in the Achronim, but not to have tashmish. And then the period will come. Then the question is, let's say day 2, day 3, day 4, she's still on her placebo. The period hasn't come yet.
We have that. I have that question all the time, especially when patients take 3 months in a row of the pill, and then they stop it, and the placebos, and their period never comes, and they want to know when should I restart my my pills. I'm waiting for the period, and it never showed up.
Yeah.
Or they've been taking their pills, and now they are finished their course of pills and are going to start to try to get pregnant, and they're waiting and waiting and waiting, and no period comes for 1 month, 2 months, or up to 90 days after stopping the pills.
Wow.
So we do have this come up on a pretty regular basis.
Yeah. So I generally tell people that by the way, there's also a difference between a woman who's on this pill for multiple months. So let's say she knows that she always gets the period 72 hours, and it's been 3, 4, 5 consecutive months. She only gets her period 3 days. So within that time, it's totally permissible for her to have relations because she's built a chazaka that she's not going to see within those first 3 days, those first 72 hours. But let's say she's past that and she still hasn't seen. So I think that as after a few days, 2, 3, 4 days after she's expecting the period, and especially when she goes back on the active, some poskim say once she goes back on the active, then you're good to go. Other poskim say, no, you don't have to wait for her to go back on active. A few days when she really feels that she's in the clear and there's nothing doing, she can do a bedika and then she can resume tashmish, similar to getting herself out of an ona. So she can do a bedika and then she can resume tashmish if she feels that she has skipped that month and she's not going to get a period. I'll tell you a very interesting shayla, Dak, and I want to hear your perspective. What would you say to the following? A woman calls me and she says that she went off the pill. She's on her placebo now, and she started spotting. but it's all brown. So I said, it was in her underwear. So I said, okay, bring this to the Rav and ask him what color is this. Maybe sometimes a woman says it's brown, and she says woman lives in New York. I'm in LA. I said, bring it to the Rav. So she brought it to the Rav. The Rav looked at it. The Rav said it's brown. It's not a problematic color. It's tahor. It's brown, but it's not a reddish brown. And she had this consistently over the next consecutive 2-3 days, and then it stopped. So she definitely had a somewhat of a flow, but everything that came out of her was brown. So she said, and she knew that her period was coming because she was on her placebo, but it was brown. So she asked if she was a nida.
So what's my answer to that? Well, if you're asking me where it came from, I'll tell you it came from the uterus, and there probably was a little bleeding, but not so much bleeding, and it took its time to get out, and it looked brown when it came out because it was old already.
Yeah.
Without knowing or paskening halacha and just asking me where that came from, well, I'll tell you in all likelihood it was uterine bleeding that was, again, appeared old because it just took its time to get out.
Yeah. So halachically, so she asked me what the halacha was. I said, listen, I'm not there. I can't see it.
No.
Show it to a Rav. If the Rav said that it's a kosher color, I told her it's fine. So then she says, but how could it be? She alluded to what you were saying. How could it be? I'm expecting my period. And I said, listen, and let's say it was beige. Let's say it was yellow. Would you also feel emotionally uncomfortable but how could it be? But it's yellow. I'm supposed to be getting a period now. I mean, once the Rav says that this color is halachically permissible, that this is not a maridam, so just like that's not a maridam, yellow is also not a maridam. Right. So I was comfortable saying that this woman was not a nida at all, even though she had discharge, and it most probably did originate in the uterus. But once the Rav took achrayus and said that this is not a problematic color, I was comfortable saying that it's not. There's that tshuva. Reb Moshe has a tshuva. Reb Shlomo Zalman also writes about this, about a woman that injects blue dye, into her blood system, and every time she gets a period, anytime anything comes out, it's blue. So it's the time of the month, it's most absolutely blood, but since she introduced this dye into her blood, anything that comes out is blue. Reb Shlomo Zalman and Reb Moshe write, she's not a nida, because nida blood is red, and this is blue. Even though she did something to color it, right? Now, I don't know anyone that's actually ever done that.
No, I don't know how to do that. I know how to make the urine orange, and
so Reb Shlomo Zalman, as we know, Reb Shlomo Zalman had many children who did not have any children. Reb Shlomo Zalman had many, many children who suffered with infertility forever. And Reb Shlomo Zalman was always on the forefront of writing the most creative and innovative concepts and ideas on how to get a woman to the mikvah that she shouldn't be a nida so that she'll be able to have children. And the reason why Reb Shlomo Zalman was sometimes so outlandish and so creative was because his very own family was struggling. So many of his children were struggling with infertility, and so many never had children. Ad hayom hazeh. But also fascinating discussion.
And certainly we found many, many ways to now get people to the mikvah and have them ovulate. We have, even today I spoke to a patient who ovulates 3 or 4 days before mikvah. And we give them, now there are numerous papers on Jewish infertility, how we could push with estrogen, how we could push the ovulation off a few days. And we've had success with that many, many, many times in shifting ovulation.
Yep.
2 similar types of birth control are the patch and the ring. Basically the same type of concept and the same medication, similar medication to the pill, a different delivery system. One is a patch that's put on weekly. The other one that I'm talking about is the NuvaRing that's put in once a month and stays in the vagina for the month. And there's another similar one called Anovera, which is a yearly. It's a much thicker NuvaRing, and it has enough medication that it could remain inside for a year straight. Although the company has you take it out and put it back in, but has enough medication for a year. There are, from what I understand, there are similar problems. There are some problems with both of these methods, and the biggest problems that we talk about are the problems with going to the mikveh. You have a patch on, you have a ring in. Could you address that for us?
Yeah, the patch, as you mentioned, it's similar to the birth control in that it doesn't have any interference, in the vaginal area, but you do have the mikveh issue. It's a chatzitza. So typically, what we would love is if women could schedule their patch, their schedule to take it off and then dunk and then put a new one. That would be the best option. It really is a chatzitza, although there are certain ways around it. Some poskim say that if you take something off and then you're going to put it right back into the exact same spot, so that's not called a chatzitza. I mean, the patch remains in the same exact spot every time, or it goes into different.
They move it each time.
So then that becomes more problematic. If you move it each time, if it stays stationary, right, it's in one place, and then sometimes it has to come off. But I put the other one right back on, so maybe you could view that as a it's kavua. Sometimes it has to come off a little bit, but it'll come right back on. It is a problem. It is a problem as for a chatzitza. And therefore, before getting the patch, you need to really speak to the doctor to make sure that the schedule that you're on, you can sync it with your tevilah to make sure that it can be removed and then put on after the tevilah.
So what we do is we have a little deal with the rep from the company is they leave us a few extra patches, and we give an extra patch to the patient because insurance won't pay for it at that point. And they go to the mikveh, they take that one off, and they put the one that we have on, and they have enough to go.
Yeah. And if it's off for a few minutes, it shouldn't have any impact at all. Neither in efficacy nor in hilchos, neither that it'll cause spotting.
But in our experience, is after a couple of months, the patient gives up on it because it's too tough for them to. Yeah. The second one was the nuvaring. The nuvaring and going to the mikveh, it's placed in the vagina. It doesn't act as a barrier. It's a ring. Right. So it's, I always tell the wife, the husband won't know it's there unless you tell him it's there. It's left in during intercourse for most people. But for mikveh, I assume that they have to take it out.
So there's mikveh, there's also bedikas. On a lichatchila level, the nuvaring should be removed for the hefsek tara for that very first bedika. And then either day 1 or day 7, one of the next bedikas. If it's going to be on day 1, day 7, some poskim say both, some poskim say neither. It's a big machlokas. I think many poskim are comfortable saying that if you take it out for the hefsek tara, take it out for one bedika, and then take it out for mikvah, then you're good. Now, what happens if a woman left it in from beginning to end, left it in for her hefsek tara and all of her shiva nikiyim and her tevilah? So b'di'eved, I would say it's fine. Your bedikas are fine because for the most part, you're still getting access to the area and it's really not coming in contact with the bedika so much that it's preventing the bedika from doing its job. And similarly, when it's inserted so deep into the body, that has a halachic status. It's something called balua. That's not something which is on top of the skin. That's not something which is just a chatzitza that I should remove. It's internal, so something which is like swallowed up. It's balua. It's inside the body. So on a b'di'evad level, maybe even a lichatchila level, that's an okay thing for the mikvah. So the best option for a woman with the nuvaring is that she should remove it again for the hefsek tara and perhaps one of the bedikas and for the mikvah. If she forgets, it won't b'di'evad. It will not impact the bedikas, and she would not have to go back to the mikvah before being with her husband. She can continue living with her husband without going back.
We're up to number 11. So we have 11, 12, 13, 14, and 15 to accomplish. 11 and 12 are the IUDs, the copper IUD and the hormonal IUD.
I feel like we could have a session on the IUD alone.
We can, and we've talked about it. The major topics that we talked about and which become very difficult is insertion of the IUD and removal of the IUD.
Yeah.
First, having an IUD in, again, after your Rav says long-term, 3 years, 2 years, 5 years is okay, or you could have it longer, or whatever the arrangement is. once it's permissible to put it in, is there any preference between a copper IUD and a hormonal versus a hormonal IUD? It's very interesting, the discussions that I have with the patients. With each of the IUDs, after you put it in, it's common to bleed for a month. So I tell them to expect bleeding for a month. And I understand that the first couple of days after you put it in has a different status, possibly from the rest of the bleeding, possibly.
Meaning better, meaning you can control an amaka.
Yes.
You can assume that the bleeding is coming from a maka, yeah.
So we'll get to that in a minute. With the copper IUD, they should expect to get their period when it's supposed to come. So monthly, they'll get their period. It will be usually heavier, so there's heavier bleeding, but there's no hormones in it. So a lot of my patients says, "Oh, that's good for shalom bayis. I have my period every month, and I like the idea of no hormones because hormones make me feel this, that, and the other thing." The hormonal IUD, on the other hand, after that month that it takes the body to get used to it, about 20% of patients don't get periods at all. I have an acquaintance, a friend who hasn't gone to the mikveh in 12 years now. She's had all of her children and keeps, the IUD, and it works very nicely for her, and she's very happy. And she says, "It's great. I don't have to go to the mikveh. That's great for shalom bayis." So we have two different approaches. 60% of the people will get some type of spotting, but usually less bleeding when they have their period. I have a patient who every month spots and every month asks the shaila, and her husband says, "I'm getting tired of asking the shailas." I go, "What does the Rav says?" He says, "I'm never in nida." I go, "You still have to ask," and he still has to tell you, but I don't understand what you're complaining about because it's working the way you want. Unfortunately, 20% of people keep getting spotting and bleeding, and after 3 months, we say it's a bad experiment. No matter what we try, we can't get them to stop, and we end up taking out the IUD. So those are the differences between the two of them. Insertion of the IUD is similar for both. The way I do an insertion is I do it with an ultrasound guide, so I could see where it's being placed. Uterus is tipped in all different directions. And if you do it blindly, it's easy to think it's in the right place, but it's not. So we confirm that it's in the right place as we put it in. I rarely, if ever, have to dilate anybody who's had a child. I do put in some IUDs. Again, I take care of a whole host of different patients, of some people who have no babies. And then I do have to dilate them. And we talked a little bit about dilating 19 millimeters, what the halachic ramifications are going above 19 millimeters, which is the size of two fingernails, is 20. So we're talking about 18 or 19. And I understand some Rabbanim say there's an issue if you dilate more than 4 millimeters. So could you just bring us up to date with what that means?
Yeah, the Gemara talks about when a woman gives birth, or when a woman's uterus opens up and some object comes out. So the Gemara says that woman would be a nida. The Gemara says why? Maybe there's even in a case where there's no blood. So the Gemara says because ein psichas hakever b'loy dam. You can't have the opening of a uterus without blood. So that's talking about a woman who had something inside of the uterus which was expelled outside of the body. The Yehuda and others discuss, what if you're coming from the opposite direction, from outside of the body in, and you are accessing the opening the cervix from outside inwards towards the uterus? Do we apply EF Shalipsichas Hakeva below down? We generally assume yes, although not everyone agrees. There are shittas that hold that we do not say Ein Psichas Hakeva below down. And what the Gemara tells us, when the uterus opens, it must be expelled. Opening with blood is only when things are coming from inside out, but not the other way. But our general psak is that both directions, whether something is coming out of the uterus out of the body, or from outside of the body into the uterus, once the cervix is open, then we assume that there is a shaila of nida. The $1 million question is, how much of an opening is called an opening, in which we would say because the Gemara does say that there are things which are dak shebedakim, very, very thin, which can go into the uterus and will not cause any opening and will not cause an issue of nida. Many of the catheters that are used for an IUI or anything like that are going into the uterus are so small that that certainly doesn't have an issue. Amongst the poskim, though, there are different shiurim. You mentioned the very machmer approach of Rav Vosner, and Shevet Alevi has a very machmer approach, maybe 4 millimeters. Rav Avadi Yosef and Mordechai Eliyahu also have a more stringent approach. In my opinion, the most accepted halachic perspective in America now is the opinion of Rav Moshe Feinstein. And Rav Moshe Feinstein writes, as long as it is 19 millimeters or less than 19 millimeters, 3/4 of an inch, he writes. 3/4 of an inch. So then it is not going to be a problem of psichas hakever. So, I mean, generally speaking, as we've determined in previous sessions, that almost all, if not all, of the gynecological instruments that are used are smaller and thinner than 19 millimeters. The question is about dilating. So as long as you keep it, under 19 millimeters, then according to Rav Moshe, you're totally fine. That goes for the insertion and the removal.
We're going to come to if there's a difference between taking it out and.
I don't think so. It's just a matter of the dilation of the cervix.
In regard to dilation. So now what happens is I put the IUD in and I don't see any bleeding at that time. And the next day, the woman calls me and says, I'm spotting. It's not the time that I'm supposed to get my period, but I see some spotting. And we've talked about that some Rabbanim call it nida and some call it damaka. How does that?
I guess it depends. There's a well-known sheet of the Chazon Ish. The Chazon Ish felt that if you slice the uterus, you take a knife and you slice the uterus and blood comes out, that's called damaka. Because we know it's a cut. Now, it's true that it's coming from the uterus, but you see that it's coming from a cut. It's coming from a wound. It's uterine trauma. That's not nida. That's not uterine blood. That's not dam nida. Nida blood is when the uterus produces blood, whether it's your period or whether it's not your period. But the uterus is producing blood. Then that's called naturally. That's called nida. Whether it's a healthy reason that the uterus is producing blood, sometimes it's an unhealthy reason. But if that's what the body is doing on its own, that's called dam nida. As opposed to a person who slashes, makes a wound, a biopsy, for instance, when you're cutting a part of the uterine wall. So then that would, according to the Chazon Ish, that would not be a problem with nida. In which case, that blood is not dam nida. Therefore, any blood that a woman sees post the insertion of an IUD, we can assume that spotting, especially if it's just spotting and not a flow, is some type of trauma from the insertion, and we would dismiss that. I would typically advise a woman not to wear white underwear. In those situations, don't put yourself in a vulnerable situation. You should wear a panty liner. You should wear pads or liners or something like that, or colored underwear. But very often that blood can will not render a woman a nida. The issue is if the blood is consistent and then eventually turns into a flow, then we have to be choshesh that the body did react, the uterine had some type of bodily reaction to the insertion, which even according to the Chazon Ish would then be a problem.
So, I mean, I've heard in the past, 2 days is acceptable. Once you start getting past a couple of days, then it's viewed differently because you can't say.
Depends.
Okay. And we just mentioned wearing white. I always tell the patients, I have them ask me, am I bleeding? I go, don't ask me questions you don't want answers to. I generally won't answer that question, and I look at that again, like wearing duck underwear and,
What about when a woman should insert I get the shayla la. When is the best time? What would you say, Doc?
So classically, we put it in when the patient has their period for a couple of reasons. One is the cervix opens a little bit, so it's easier to put in. And also, that they're not pregnant because they're having their period. We do a pregnancy test for every single patient. But when is the much more common time that we put it in? It's post having a baby. So they're breastfeeding and they're not going to get a period. So we put it in when they don't have a period, again, along with a pregnancy test, right beforehand, and again, in discussion with the patient. So the truth is most of them we put in without a period these days.
Yeah. If you hold like the Rabbanim that the insertion makes you a nida, right? I personally don't hold like that. But if you do,
We
let me
speak
rephrase that.
about
Let me rephrase it. Assuming the doctor, when they insert the IUD, it will be less than 19 millimeters, in which case the woman will not be a nida. So then it could either be done when she's a nida, when she's not a nida. For those who, if the doctor says in your specific scenario, we're going to have to open it wider, or there, and you should the dafka do it when she's a nida, so that you don't recreate nidas. The problem is many are concerned that if you put it in when she's a nida, if they have spotting immediately after the insertion, she may lose that opportunity to get to the mikvah. Someone once told me maybe you should put it in on the morning of day 7.
Yeah.
The morning of day 7, because then you'll put it in. You'll do your bedika in the morning. Then you'll go to the doctor. The doctor will put it in. And then, assuming that you're able to wear panty liners or anything like that, anything you see that day, we can assume is a makkah. And then by the night, you'll go to the mikvah, and then you'll be fine. I've told that to a few people. The thought frightens the women so much to be able to put the IUD in on day 7. It's just too traumatic.
Much more commonly, I discuss with them, okay, you're breastfeeding, you gave birth, you're going to be bleeding for expect bleeding for up to 8 weeks. You need to speak to your Rav about what your status will be after it's placed. If he says that any bleeding makes you a nida, then put it in right away while you're still bleeding.
Right.
And if they say, no, it's damaka, we'll go to the mikvah, and then we'll put it in because you're good to go at that point.
Yeah.
The last 3, and then we'll see if there's a couple of questions that we'll address. Tubal ligation is someone allowed to have a tubal ligation, or in what circumstances could they have a tubal ligation?
Tubal ligation is a real shaila because, as we mentioned earlier, sirus isha is an isser. There's a prohibition for a woman to be mesaris herself, to castrate herself, to sterilize herself. That's a problem. Now, according to almost everyone, that is only an isser midrabanan. It's only rabbinic in nature. There is a shita of the Vilna Gaon. The Gaon paskins in the bottom of Shulchan Aruch in the Bir Agra. The Shulchan Aruch says that no, sirus isha, even a woman, would be in violation of an isser doraisa. So it would be biblically prohibited. According to the Vilna Gaon, it would be almost impossible to do a tubal ligation unless it was a situation of real pikuach nefesh, and that was the only way out of it. According to everyone else, it's an isser d'Rabbanan. It's a real bona fide isser, not d'Oraisa, but d'Rabbanan. So the situations that we have tubal ligations, that we permit them, are usually situations where women are in certain dangerous situations where they cannot get pregnant. Should they get pregnant, it would be a danger to their lives. And for whatever reason, all of the other aforementioned birth controls are not options. The hormonal options are not options because of that medical issue that she has. And her body, she's already tried the IUDs, and her body has rejected the IUDs, and So once we really get to the bottom of the list, and we say, listen, but this woman has to go on a birth control, or else if she gets pregnant, she could die. Chas v'shalom. So then poskim do permit the tubal ligation. There's a fascinating shaila: what's worse or what's better, the tubal ligation or the condom? Right? Do we say that maybe the tubal ligation happens once? You tie, you cut, and then you're done with, as opposed to the condom, where each and every act of intimacy is another isser after. So perhaps the tubal ligation is even better than the condom, but those are interesting cases. But for the most part, we do not permit a tubal ligation unless we're talking about really, really, really extreme cases.
Number 14 was salpingectomy. We've now moved away from tubal ligation, and we're taking out the entire tube instead of a portion of the tube, because we've learned that it decreases the chance of getting ovarian cancer later in life. We also have to take out now a lot of tubes because the patients carry a predisposition for cancer, like BRCA. They're still in the childbearing age, However, it's recommended that they have them taken out.
So we view those cases like pikuach nefesh.
Racist.
Right now, she's not sick right now, but if we don't act, she could develop cancer. So once we tell people, as you mentioned, have your children as quickly as you can. And then when you're done, take it out. Isn't that serious? The answer is yes. But it falls under the broad category of pikuach nefesh. That's a perfect example when we do allow for those kli zera to be removed.
And then finally, the last one, and I want to know the difference between this and taking out tubes, is a vasectomy. You alluded to it.
Well, vasectomy is on the male. So the vasectomy is on the male. So there, everyone agrees it's an issur d'oraisa. Everyone agrees it's an issur d'oraisa. So since everyone agrees it's an issur d'oraisa, so then you also have issues of p'tuadaka and a krishufcha. You can't marry into the Jewish faith. So vasectomy is definitely off the table. That's not a question.
I left it for last. It was
that's not a question. The tubal ligation, then there are ways around it because if it's only midrabanan, so then there's definitely ways around it. But a vasectomy, I'm not familiar with any case. So again, the only way that we'd be able to permit a vasectomy is in a case of pikuach nefesh for the guy. But I don't know what would the case be where it would have to do it on him. If you take care of her, then it won't be an issue.
Treatment of testicular cancer.
Usually testicular cancer, we take out one of the testicles.
But the other one
of the testes.
I have not heard of both.
Yeah. No, it's very common to take out one test. The truth is, we've had wonderful success even with fertility after testicular. You think testicular cancer, that's like never going to have kids afterwards. We've had a number of children born post treatment for testicular cancer. They take out one testicle, they have another testy, and then usually I know a number of children that have been born. Their fathers are survivors of testicular cancer.
Maybe we could look through a couple of these questions. So why is the diaphragm different than halachically from a female condom? We spoke about that. What if you are over 50 and can't use birth control anymore, but you are still fertile? What do you suggest to use? Again, that's a discussion. If it's long-term, an IUD is a great option for those patients. And we do that very, very often. What do you recommend for birth control for a couple with genetic issue? That's we've spoken about this for a long period of time. It depends what the genetic issue and what they need the treatment for. What is your experience with Phexxi? I find that Phexxi is exactly what we expect it to be. It's a spermicide. I look at it as a delay tactic. You just want to delay getting pregnant, but if you find out that you are pregnant, it wouldn't be a surprise to anybody, just like other spermicides. Maybe a little bit more effective than the over-the-counter, but in practicality, I can't measure that because we don't get hundreds and hundreds and hundreds of people who get pregnant. But like I said, my view is the same view that I would look at it as the over-the-counter spermicide. Is the recording available to be sent by email? No, in the next few days, when I get a chance, I'll post it on YouTube along with all the other ones. And you could look for it there. And I'll get that up as soon as I can.
There's one last one. What do you recommend for birth control for a woman who has very negative reactions to hormones?
Well, it depends on what they want to accomplish. For short-term spermicide, for long-term a non-hormonal IUD. Discussion is had with each person what they're trying to accomplish. Again, under supervision that we need, and then we decide which way to go with that.
I think the best way to end off this session would be that if anyone out there is able to invent a non-hormonal birth control, which is 100% effective and has no side effects, that's an easy way to become a billionaire. So if you find out, let us know.
Good. Please send us your comments and questions. Certainly, I keep a little collection of them, and in one of our upcoming discussions, we'll just again, have 20 questions that people have sent us or comments, that we'll talk about.
Just one last question. Someone asked, in your professional experience, what do you find more common, the NuvaRing or the pill? What are most of your patients?
Still, the pill trumps everything. The pill is used, and the reason why the pill is used more than anything is, I think today it's very reliable, and it also allows the patient to manipulate their period. Right now and it happens every Erev Yantif, Erev Pesach, and also Erev Sukkot. I'm inundated with requests for pills to push off the period. So they go through all Yantif without a period. And the ones that I don't get requested are because the patients are already learned to have themselves how to push off their period to avoid having it during Yantif.
Yeah.
So,
by the way, just one thing about the NuvaRing, which I just remembered, is that there is a shiloh. We have this by the diaphragm also. Once you remove the diaphragm or you remove the NuvaRing, should you find blood on the NuvaRing, that's a real shiloh, like finding blood on a bedika cloth. So that's sometimes the woman goes to a bodekas and she'll locate a makkah that there was some type of irritation. But that's another reason why some women prefer the pill. Where you don't have to worry about taking something out, putting it back in for bedikas and for mikvah, and also the scare of potentially seeing something after you take it out. Of course, you shouldn't look, but if you looked, then it's an issue.
I do see that I am looking at the chats and comments below. I do agree. If you see blood on it, most of the time medically, it's because it's scraped on the way out. Especially when you aren't expecting to have blood, but still, if you have to ask a shaila, you have to ask a shaila. But I do agree with you that that's probably what it is.
All right, very good.
Good.
Everyone, thank you for joining us. Thank you, Dr. Herman.
Good. We hope to speak soon.
Very good. All the best, everyone. Have a good night.